which I may ask you to take note of or mark in the textbook. Please note that. Those who have not received the textbook, don't worry, you can at least make a note of these important page numbers and topics, as I say, because I will be mentioning the page number, paragraph, and everything, if at all anything is important from exam point of view. So please make a note of that in a note in a small paper. You can later translate that when you get the textbook. Those who have textbook, I hope you have the nutrition book with you. It will be easier if you have textbook along with you for these classes. So with that, we'll start the chapter protein, chapter 5, page number 64. So the main functions of protein is for growth, for maintenance, for all the physiological function in your body, and the repair of tissues. And yeah, these are the three main functions of protein. So that's there in the first paragraph itself, the introductory paragraph of dietary protein. So mark that as important. So the three main functions is given: growth, maintenance, and repair. So 50% of the protein is found in your muscle. Whatever dietary intake of protein you have took, okay, that will be translated, like 50% of that will be translated in your muscle, 20% in bone, 10% on your skin, and the remaining will be that assimilated in the other parts of your body. Okay, so the same content is given in the textbook also. You can mark that. So if the question comes like, what are the functions of protein? Like we will give you the multiple choice: growth, maintenance, repair, all of the above. So it's quite easy, all of the above, okay? And the constituent of protein, the protein breakdown in your body, how it is assimilated in the body. These percentages are also important. These percent values may vary from other sources, but for the sake of your exams, please stick to what is given in the textbook. For practical reasons, you can definitely consult other sources of or other materials also. Then we'll briefly touch upon the chemical composition of protein from the biochemistry aspect. So remember that protein is the only component of food which has nitrogen attached to it. Lipids, like the fats, they don't have the nitrogen component, and carbohydrates also doesn't have the nitrogen component. Only proteins are the component of food that has this nitrogen, and this nitrogen is required for the production of various enzymes and to maintain many physiological functions in your body. We'll discuss that later. So that is how protein is set apart from other food components. Okay, so it is synthesized from amino acid molecules. Protein is made up of different amino acid molecules. There are 20 different amino acids. 9 of them are essential, 11 of them are non-essential. We'll see that later. So remember that there are total 20 different amino acids. 9 are essential, 11 are non-essential. They form various combinations. These different kind of essential amino acids will form various components. There are proteins that has more than 100 amino acids combined in a single molecular component. Okay, proteins contain nitrogen, carbohydrates and lipids don't. Here you can see the amino acid structure I have mentioned. So four main groups you have to remember here. Okay, you can take a screenshot of this. You can take a screenshot of this, so it is easier for your reference. The same image is also given in the textbook. So this is the carboxyl component, the COOH, 2 molecules of oxygen, single molecule of hydrogen, 1 carbon molecule. So carboxyl group. There is an amino group, the nitrogen, single nitrogen molecule, and 2 hydrogen molecule. Okay, 1 free hydrogen molecule is branched out, and there is a side R change. This side R chain, this is where different amino acids will come and form different types of protein. Okay, so we have just put it R like this. Different amino acids will come and attach themselves here, and that is how we have a different essential amino acids. Okay, So this is what the R chain is, what changes. That is what will set apart one amino acid. That is what differentiates one amino acids with respect to other. Okay, so this is just a basic chemistry. Don't fuss more about this. Just if you're clear about this, these groups, this is the basic amino acid structure. These are the different groups present in the basic amino acid structure. What are the groups that is present? Carboxyl group, one hydrogen molecule, amino group, and a side R chain. Then we'll discuss the properties of amino acids. So remember this, because if you want to understand certain functions, which we will speak later on, your concept about the properties of protein should be clear. So amphoteric nature means a substance which can act both as acid and base. Okay, so remember this property. I may ask question later, so you should be able to relate this property of protein to the questions which I may ask later on. Okay, so the protein can act as acid as well as base. Okay, because the body requires certain pH for the equilibrium to be maintained and other biological functions to take place. Okay, whenever this pH is hampered, the protein will come into play. It will act as a buffer to bring back the pH to the normal pH level. The pH can be alkaline or acidic depending upon the normal function it has to do. Okay, so protein is amphoteric in nature. It has electrical charges to the skeletal structure which we have discussed. Okay, and because of those electrical charges, the pH can change around. Then we have solubility. There are certain proteins like albumins. Albumins are water soluble, and globulins are not soluble in water, but they are soluble in the presence of sodium chloride. Okay, so the proteins which are not soluble in a particular solvent, you can see it will form, it will have a cloudy nature. Okay, so this is also taken into consideration when urine analysis and everything is done to check what are the components of the urine which you have given for test. Okay, too much of protein in the urine may make it can be a conclusive fact that there is something wrong with the kidneys. Okay, so this is how solubility matters. So proteins are soluble, but in a specific solvent. Okay, there are certain proteins which are water soluble, certain which are not, which are soluble in presence of other electrically charged components. Then we have colloidal nature of protein. It means that proteins have large molecular weight. Because of that, you must have learned in your basic chemistries and all that cell membrane, our cell membrane is a semi-permeable membrane. It means ions and other molecules can pass through it. Okay, the molecules which are small in size, which has very less molecular weight, they can pass through the semi-permeable membrane. But protein naturally has higher molecular weight, because of which it cannot easily pass through the semi-permeable membranes like cell wall, etc., which is present in the different tissues of the body. Okay, so because of this particular colloidal nature, how is it helping? Okay, so proteins, because of this nature, it cannot be lost. Okay, if it is lost, if the protein is lost from the cell membrane, for example, I just told earlier in urine analysis and everything. Okay, so if there is a protein in urine, it indicates that there is a damage in the kidney membranes, possibly because of an inflammation. Okay, nephritis means inflammation of the kidneys, and therefore there should be ideally there should be no protein in the urine. Okay, so also another important factor is that because proteins have a colloidal nature, proteins which are present in the bloodstream, it will not just pass through the capillaries and go into the tissues and settle down there. The proteins which are supposed to be in the bloodstream should remain in the bloodstream. It should not deviate from its deviate from the bloodstream and go and settle down anywhere else. How can it prevent itself from this? Because it has a colloidal nature, means it has a large molecular weight. So our blood vessels, as you know, they are also semi-permeable membranes, so they will not allow large molecular size proteins to pass through it. So That is how it helps. So these are the three properties of protein which is mentioned in the textbook. Be clear in the concept of this. This will help you with determining the other functions of proteins. Now coming to classification, please take a screenshot of this particular slide, because in the textbook it is given in a table format. I guess this will be much more helpful to remember which kind of protein will come under which classification. So basically you can classify proteins into simple, conjugated and derived. Okay, under simpler you have globular proteins and fibrous proteins, also called as scleroproteins. Okay, so keratins, collagens, elastins are the scleroproteins abundantly found in our skin and our cells and everything, ligaments, tendons. Okay, so these are the fibrous proteins found abundantly in our body tissues, and these are the globular proteins, uh, majorly found from the diet. Conjugated proteins, nucleoproteins, glycoproteins, lipoproteins, phosphoproteins, chromoproteins, metalloproteins. Derived, you have primary and secondary subclassification. So I hope, can I change the slide? Here only you have to remember like what kind of, don't mug it up, just understand. Okay, this is how we'll classify the proteins. Okay, the same content is given in the textbook in tabular form. And what are the different characteristics of each of these proteins are also given. You can read through it. No need to by heart this, just understand the simple classification of protein. We classify them into three areas: simple proteins, conjugated and derived. Okay, simple proteins, again, we further classified it to globular proteins and fibrous proteins, conjugated and derived. Derived proteins we require, it is not available in free form outside, it has to be synthesized within the body through various chemical reactions. In conjugated proteins, these type of proteins are attached with different forms of molecules. So yeah, we will go to the next classification. Next, these are kind of the from dietetics point of view and from the nutritional point of view, these kind of classifications are much more important. So nutritional classification, the first classification we have is complete proteins. So these are the proteins which have all the essential amino acids in the required proportion by the human body to promote a good growth. For example, you find complete proteins in egg, albumin, milk, and all. So remember, all the 10 essential amino acids is required, which is required by the human body in the correct proportion. Okay, it is available in the same proportion through these dietary sources. That is why we call it complete proteins. We have a list of 9 essential amino acids and 11 non-essential amino acids. So all the essential amino acids which the body requires for maintaining certain equilibrium, everything is available in this particular one source of protein. Okay, that is complete protein. Then we have partially complete protein. Okay, so for example, some sources of proteins may have 7 or 8 essential amino acids. The remaining 2 or 1 is not available in that particular source. That is partially incomplete. Okay, they lack 1 or more essential amino acids and can promote in moderate growth, not optimum growth. For example, wheat, rice, etc. You have to mix this incomplete protein with other partially incomplete protein. For example, wheat and rice may lack in tryptophan or something like that. Okay, so you have to eat legumes along with that, which has tryptophan or other form of amino acids, which will complement each other, and it will give a complete package of essential amino acids in your diet. Okay, so usually when your food has a lot of partially incomplete protein, combine this incomplete protein with the ones that will complete the complete the 9 categories of essential amino acids. Then we have incomplete amino proteins. So these will completely lack more than one or more. It may hardly have 2 or 3 essential amino acids. The majority of the essential amino acids is missing from its molecular structure. They do not promote at all in growth. Okay, for example, gelatin. So yeah, the same explanation is given in the textbook. So no need to take a screenshot of this. Then we have nutritional classification of amino acids. We discussed about proteins now, the classification of proteins. You break down the proteins, okay, into their molecular structure, you get amino acids. Okay, so now we will, we were discussing there are essential amino acids, there are non-essential amino acids. So what forms essential and what forms non-essential and conditional essential amino acids. So essential amino acids cannot be synthesized in the body. Your body cannot make these amino acids on its own. You should get these amino acids from your diet, exclusively from your diet. So that is why we call it essential or indispensable amino acids. Cannot be synthesized in the body and have to be taken in diet. Okay, so few examples of essential amino acids are given here. Valine, isoleucine, leucine, lysine, methionine, phenylalanine, threonine, and tryptophan. Then we have semi-essential amino acids. So these are growth promoters. Okay, they are also not synthesized in the body in adequate amount. Body can synthesize them, but not to an adequate amount to which it will be helping in the growth. Okay, so you do require the semi-essential amino acids, certain percentage of semi-essential amino acids from your diet. Okay, so because optimum, if you have optimum growth promoters, usually they are the precursors to enzyme formation and other biological functions. So these are the precursors. So if optimum amount of precursors are present in the body, then only functions can be continued. Okay, then you have non-essential amino acids or dispensable amino acids. Your body itself can synthesize this amino acids, not essentially required from diet. So it is not a main component of it should not be a main component of your diet, because your body is capable enough to make this. So glycine, alanine, serine, cysteine, asparagine, glutamine, tyrosine, proline. This is a list of non-essential amino acids. You do not require these amino acids from diet, your body can make it. Semi-essential amino acids are usually required in the growth stage, that is in infancy, in the age group of toddlers, infants, and preschoolers and all. They require semi-essential amino acids because most of these amino acids are help in the growth hormone synthesis and all. So that's the age group that requires semi-essential amino acids most through the diet. Then functions. The first main function is growth and maintenance. So it is self-explanatory. For growth and maintenance, you do require protein for building muscles, for the vital process of your cell division. Okay, when you grow, there is a lot of cell proliferation taking place. Okay, so cell division, you require protein. And even the framework of your bones, your skeletal framework, the framework of your teeth, bones, they are composed of protein molecules. So there you require protein. And collagen, as we discussed earlier, it's also a main So collagen is a kind of protein which is found within the tendons, ligaments, your skin, etc. Elastin. Okay, these are the kinds of proteins that is present in the skin cells, etc. to keep the cells together. It binds the cells together. Okay, so that is how the that is how growth and maintenance is the main key first function of protein. Then we have formation of essential body components. As said earlier, certain proteins will be broken down into amino acids. These amino acids will be further synthesized in the body to produce other enzymes and other hormones for optimum functioning of the body. So enzymes are required for digestion, etc. Hormones are required for growth and maintaining the other cycles of the body. Okay, like insulin, gastrin, etc. And some proteins are act as carrier for other nutrients. For example, hemoglobin, it is a carrier for oxygen molecules to reach the tissues for their optimum functioning and all. So that's how protein will break down and it will form other essential body components. Transport of nutrients. There are certain proteins which are called as carrier proteins. Okay, so they usually are found in the intestinal walls and all. They will transport the nutrient from the intestine into the blood, and from the blood it will be deposited into the tissues. So there are different carrier proteins which do this function. Then you have regulation of water balance. Protein helps to hold the water within the cells. Okay, if at all, in pediatrics we have this disease called kwashiorkor. So in that, if you search about kwashiorkor in Google, you can see that there's a lot of fluid deposition in the body, the fluid retention in the body. That is the reason is when protein is very deficient in a diet. Okay, there is nothing that will help to hold the intercellular and intracellular fluid. Okay, the fluid will easily come out of the cells and be deposited in the extracellular space, etc. So if you have a regular protein intake in your diet, you will not face too much of fluid retention in the extracellular space and all. So that is how protein will help in water balance. Then you have maintenance of pH. So what was the property of protein which will aid in maintenance of pH? From the properties of protein, anybody in the chat box? That's the first property of protein which we discussed. Yeah, there is a name for it. Yes, protein is amphoteric in nature. So because it acts as both acidic and basic. Okay, so you have to remember that if the body goes in a state of acidosis or alkalosis, means your body fluids become too acidic or too alkaline. Okay, both these conditions are very critical to your health, and it may lead to death also in extreme cases. So this is why we require protein. Okay, especially the protein which is present in the blood, they act as a buffer, so that as soon as the blood is turning a little bit more acidic, this protein will release its hydrogen ion and make it more basic. Okay, so that is how the protein acts, because you remember that hydrogen ion will make uh, a fluid more acidic, and hydroxide ion, it will make the fluid more basic. Okay, so protein has both these ions. So depending upon the change in the fluid, okay, these proteins will release their ions, which will bring back the fluid to the normal pH level, which is required, which is as required by the different areas of the body. Some areas should be acidic, some areas should be alkaline. So depending upon the environment, the protein will act as a buffer and it will change the pH level. defense and detox. For example, you must have heard about antigen, antibodies, etc. Antibodies are nothing but they are proteins. Okay, these proteins will help in your immunity. So if your antibody levels comes down, you are more prone to getting lot of infection. Then finally, energy. Carbohydrates and proteins will keep the same amount of energy, that is 4 kilocalorie per gram. Okay, but only when the body is in a deficient state of carbohydrates and lipids, only then protein will be used up for the energy requirement of the body. Otherwise, most of the proteins are stored in the muscles and the liver for other synthesis and other physiological functions. For energy requirement, carbohydrates and fats are exclusively used to meet the energy requirements of the body. But if your diet is deficient in carbohydrates and fats, only then the protein will be taken up for energy requirements, and automatically the body will go into the state of protein deficiency because tissues are not getting enough protein to maintain their physiological functions. Okay, so you have to be very careful about that. Now, digestion and absorption. You can take a screenshot of this image, because what is given in paragraph, it may be a bit confusing, but if this image is clear, it is easier for you to understand digestion and absorption of protein. So there is another one topic, that is specific functions of amino acids. If you want to dive deep in to get the more technological details about the amino acids, then you can read it on your own. Okay. From page number 70 to 72, specific functions of amino acids. You can do a self study on that. It is more technical. Okay. Otherwise, at least if you know few names of specific amino acids, that is more than enough. So coming to the digestion and absorption. So hydrolysis of the proteins will take place. Hydrolysis means the hydrogen molecules will break down the different bonds in the amino acid structure of the proteins. So gastric digestion, you can see here in the first step. Okay, dietary proteins which is ingested, it goes to the stomach. Okay, so proteins are denatured by the acid in the stomach. HCl, hydrochlorine is a chloride acid which is present in the stomach. Okay, so proteins get denatured there in the stomach, and proteolytic enzyme is present in gastric juice, that is pepsin. Pepsin is the component of gastric juice. Both of these will make sure that the proteins are denatured, and it is partially hydrolyzed and it becomes polypeptides. Proteins become polypeptides in stomach. Okay, but if the stomach doesn't have enough amount of HCl secretion or gastric juice secretion, these proteins will not be converted into polypeptides. That is, the digestion of your proteins in the stomach is negligible. Okay, so for optimum digestion of proteins in the stomach, at least the conversion of proteins into polypeptides, you require a pH of 2. Okay, pH of 2. Remember that, underline that, optimum pH is about 2 in the stomach. Okay, it is given under the gastric digestion section in page number 72. So the optimum pH is about 2. And at this optimum pH only the hydrolysis will take place. Okay, and the food which is in the stomach, it is there in the stomach only for a very limited amount of time. So in that particular time, the pepsin has to hydrolyze the dietary proteins and make it into a mixture of polypeptides. Ideal pH is 2. It is given in the textbook. Okay, in stomach, we are talking about stomach. When it goes to the intestine, the pH changes. Okay, As told earlier, different areas of the body, the pH value is different based on their physiological functions. So after getting denatured here and partially hydrolyzed, that is converted into polypeptides, these polypeptides will go to the small intestine. Okay, here in the small intestine, there is an enzyme called protease. Okay, protease will break down the proteins further. Okay, it will break down the polypeptides further uh, into further small molecules. So the digestion of polypeptides will take place in the small intestine with the help of the enzyme protease, and the pH should be 7.4 to 8. Underline that. Proteolysis in intestine is the section. You can see in the fourth line there, trypsin and chymotrypsin act at pH 7.4 to 8. So at this optimum pH, further breakdown of the polypeptides will take place, and then it will be absorbed in the small intestine. Those who have attended last class, they would recall the transport mechanism, absorption mechanism called active transport, in which we have discussed that uh, when there is a sodium ion present, sodium ion will drag the glucose along with it while getting absorbed. So that is one way in which glucose gets absorbed into the body. The same is applied here. Okay, in the presence of sodium ion, okay, amino acid will be directly absorbed along with the sodium ion. So sodium ion is essentially required for the absorption of both amino acids as well as glucose. Okay, so because with the help of active transport, with the help of the presence of sodium ion and other carrier proteins which are already present in the small intestine, these small molecules of amino acids will be actively absorbed by the intestinal lining. So we have seen gastric digestion with the help of hydrochloric chloric acid and pepsin at the ideal pH of 2. After that, proteolysis takes place in intestine with the help of enzyme protease. The ideal pH is 7.4 to 8. Absorption will take place with the help of sodium ions. Sodium ions will also drag the amino acids along with the glucose into the tissues. Then digestibility of the protein. So it varies from food to food, digestibility. Okay, it is given that the animal proteins are most easily digested and absorbed. Like if you are having 100 gram of animal protein, okay, you are having certain animal meat or chicken, like anything like that. If you are having 100 gram of proteins, it is said that 90 gram of protein will be absorbed by the body. Only 10 gram will be excreted, it will be released out of the body. So in digestibility, proteins from animal proteins are much more and easily digested and absorbed as compared to plant proteins. So plant foods, it varies from 60 to 90% depending upon the type of food, and legumes, it's digested about 80%. And also the other factor that affects the digestibility of protein is how you cook it. Okay, if you're cooking a food using moist heat method like steaming a food or boiling it, rather than just dry roasting it or anything like that, or using dry heat like microwave and all, okay, so that affects the digestibility. So using moist heat generally improves the protein digestibility, whereas dry heat methods like microwave or hot oven and all, okay, those can impair the digestibility of protein. Next is metabolism. Please take a pic of this particular slide just for your understanding. Okay, so in short, I'm going to explain the metabolism. It's like protein which is ingested by the body, protein which is ingested by the body, it will be broken down into protein which is ingested into the body, okay, it will be broken down into amino acids. We have discussed that just before, okay, in the digestion and absorption. The amino acids which have been absorbed, okay, 80% of it will go into the liver for further synthesis and produce other protein related enzymes, to produce hormones, okay, to produce other carrier proteins, etc. Okay, so 80% of the protein which has been absorbed, not ingested, the protein amino acids which has been absorbed by your intestine, okay, that from that 80% will be synthesized, stored in the liver, and it will be used for synthesizing and making other proteins, which will finally come out as enzymes, hormones, etc. And 20% will undergo oxidation, okay, and they will be carried, they will be released out of the body in form of carbon dioxide, or during any excretion process, okay. They take the part in other cycles, okay. So only 20% will be released out. 80% of the protein which has been absorbed will be stored in the liver. So remember this thing from this slide, liver is the primary site of uptake of most of the amino acids. It is 80% which is going, it is going into the liver, and then liver will be controlling the remaining percentage of how to use these amino acids for maintaining an optimum physiological function. Factors affecting protein utilization. Amino acid balance. So when we discussed about the different types of classification of amino acids, partially complete amino acids and all, okay, so that plays an important factor here. The essential amino acids which are partially complete, okay, we had a complete, incomplete, and partially complete, okay. So when it comes to especially partially complete amino acids, that's an important factor here. So excess of any one amino acid in certain circumstances can reduce the total nutritive value. If there are 9 different essential amino acids, okay, only few of them out of this 9 is access in your diet. The remaining essential amino acids are very low. Okay, the source of those particular amino acids are taken very low in your diet. That will affect your optimum growth and other functions of the body. So all the 9 essential amino acids should be in a very perfect balance in your diet. Calorie intake. When calorie intake drops below the critical point, like excessive weight loss regime or fasting for too long, okay, in such cases, protein will become deaminated. For example, the amino group which we have seen in the protein structure, that will be taken out. Those processes will take place in the liver, okay, deamination, transamination, and all those things. So don't fuss much about that. So when calorie intake comes down, the only thing which is remaining in the body, because most of the body is made up of protein, okay, so only thing that is remaining in the body is protein. The body will take up this protein, stores from the liver, from the muscle, everywhere, wherever the protein is being stored, the body will take that up and use it as a source of energy. Immobility. It has seen that even if your diet is optimum, okay, you have the perfect balance of essential amino acids, all the 9 essential amino acids are in perfect balance, but you are immobile, you are bedridden, okay, or in certain cases, for example, an example is given as in terms of astronauts, okay, they also lose protein because of the weightlessness and immobility in the space, okay. If the body is immobile, even if your diet is having adequate amounts of protein, it cannot compensate how protein will be utilized. So mobility is made. In case of injury, even if you had a good protein rich diet before an injury, or after an injury, certain amount of nitrogen will be lost. That has been proven. Okay, but when the rapid healing takes place, whenever you have an injury and you're recovering soon, rapid healing is taking place. At that time, the lost nitrogen can be recovered. But even irrespective of the number of protein which you are having in your diet before injury or after injury, certain amount of nitrogen will be lost. And then the final factor is emotional stability. It has been seen that people who are under emotional stress like fear, anxiety, or anger, in that case, there is an excess loss of nitrogen from the body, especially the students who are undergoing some certain exam under stress. Okay, they lose a lot of nitrogen from the body. In people who are in severe pain, emotional anxiety, who are in night shift for a long period of time, their circadian rhythm will be impaired. In such cases, nitrogen will be lost. Quality of protein. The main concept here, when you talk about the quality of protein, is that uh, the composition, for example, a protein is made up of different types of amino acids. Okay, so the composition of amino acids which you're taking from diet, okay, it should be equal to the body's composition of amino acids. So that is what we call as an ideal protein, a protein, high quality protein. Okay, the composition of the dietary source of protein is very much equal to those which is required in building new tissues. Okay, it is already present in your body. That identical protein becomes the high quality protein. So in the textbook, you can see in page number 76. In page number 76, you can see the experiment of done on two different rats. Okay, the amount of protein was same. Maybe both were given 100 grams of protein, but one was given very poor quality of protein. You can see the examples of poor quality of protein from the slide which I'm showing here, and one was given high quality protein, this side of the slide which you can see. Okay, so in even if the amount of protein is same, but the quality of protein is different, that also affects the type of growth. So that is why quality of protein is an important aspect when it comes to diet. Then we will discuss in brief about different biological assays. There is a lot of different formulas given. Okay, just remember the formula which is being shown in the slide, which is very similar to the ones given. Okay, you don't have to get too technical about this. I will just briefly explain this formula and how it is used. First is the biological value. That's the last formula given in page number 76. Biological value. It is measured as a percentage of absorbed nitrogen that is retained for the use in growth and maintenance. So here, when you have food, protein, okay, protein has nitrogen. Okay, the amount of nitrogen that is absorbed, okay, and from the amount of nitrogen that has been absorbed, how much is retained in the body, okay, the percent of that. And when even whatever is absorbed, so some amount of it is retained and other is used up for other physiological functions, and it will be excreted out of the body. Okay, that takes place, but not considering that, we are only considering what is retained in the body. Okay, that is the biological value. So retained nitrogen divided by nitrogen absorbed into 100. That is the formula of biological value. And how do you calculate the percentage of nitrogen which is retained? That is nitrogen that is digested minus the nitrogen which has been lost in the excretion. Okay, stool analysis and everything is done in this case. So so that will give the amount of nitrogen that is retained in the body. So that becomes the biological value. Next, we have digestibility coefficient, that is page number 76, the first formula. Okay, it refers to the percentage of ingested protein absorbed into the bloodstream after the process of digestion is complete. Okay, from the small intestine, when the amino acids are further divided into much more smaller components using protease. Okay, these amino acids will be absorbed. After getting absorbed, how it goes into the bloodstream. Okay, so the how much of the protein is going into the bloodstream, that is being calculated using digestibility coefficient. Nitrogen absorbed into 100 divided by nitrogen intake. Here, how it is different from biological value is that intake is not taken into consideration, only how what is being absorbed is considered. But in digestibility coefficient, the grams of protein which you are ingesting, that is considered. Then we have net protein utilization, NPU. It is very similar to biological value, but the main difference here is biological value will make no allowance for the loss of nitrogen in digestion. Okay, but in net NPU, even the nitrogen which is lost in digestion is considered. Okay, so that is here you can see in the denominator. So in biological value, when you see the denominator, they only take into consideration the nitrogen that is absorbed. What is being released by the body, that is not considered in the denominator. But in the NPU, in the denominator, where when you are taking the intake of nitrogen, the entire nitrogen which has been ingested, some will be excreted, some will be absorbed. Okay, so both is taken into consideration. That is how NPU is different from biological value. Then we have a PER rate, that is protein efficiency ratio, weight gain in gram divided by protein intake in gram. The grams of protein which you are taking, how much weight gain you will have with that particular gram. Okay, how much gram weight gain you will have with this particular gram of protein. Okay, so that is protein efficiency ratio. There are certain limitations to this thing, because weight gain is not the only function of the protein. Okay, the other functions and other aspects of the protein source is overlooked when you take PER. Okay, this PER is totally dependent on weight gain, but the other aspects and other functions of the protein is overlooked in PER. So these limitations are listed down on page number 79. Okay, so it means that the first limitation is it is not an true efficiency ratio, because not all the protein is used for growth. Some are used for maintenance, repair, and other functions. Okay, weight gain comes under the growth section, so it will only show that particular function of the protein. So it's limited in that area. Calorie intake must be adequate rather than depending upon the grams of protein. Different source of protein and different source of protein will give different types of calorie, because sources of protein will come along with protein, carbohydrates, and their own fats. So calorie is not considered here. It should be considered for the complete adequate nutritional value. Then we have NDP calorie, that is net dietary protein energy ratio, when you take calories also into consideration, as told earlier in PER, the protein efficiency ratio, that this last formula, we are not considering calories, but that can be sorted out with this ratio. Okay, here protein calories in diet is taken into consideration, not just the gram. Okay, each gram of protein gives certain kilocalories. Okay, so that calories is considered here, divided by the total calories a person is having in their diet. So the total calorie of the diet, maybe let's take 2500 kilocalorie. Out of that, how much calorie the protein is giving, okay, into net protein utilization into 100. Then we have net protein ratio. These ratios will sound very confusing, but it is used usually when you are treating a patient who is undergoing marasmus, kwashiorkor, or protein allergy malnutrition. In such cases, these uh, formulas will be used. For regular nutrition and dietetics, if you're just using this course for regular consultation or your household purposes and all, you need not worry much about these formulas. Okay, because usually the pediatricians and all who are treating the patients, pediatric patients with protein allergy, malnutrition, kwashiorkor, marasmus, certain cases, okay, in that area, based on their blood reports, their diet reports, and everything, these formulas come into play. So, just for your understanding, you can read about this. But yeah, certain, for example, the formula which is given in the textbook, okay, only the formula, if it is, you can, if you can remember it, recall it, it is better for the exam. Okay, don't no need to mug up the entire explanation part and everything. Just understand what are the different types of formulas, what are the limitations to it. Okay, so that is enough. So net protein ratio, in this thing, they had done an experiment, like most of these protein ratio experiments are done on rats. Okay, so then certain formulas and their experiments are limited to human experimentations and all. Because of certain ethical reasons. So this particular, this is also done on rats. So a group of two groups, you took two groups, you take a test group and you take a control group. Okay, in test group, you give rats 10 grams of test diet protein. Okay, and in the control group, you don't give these rats any source of protein, you give them other sources of nutrients, but their food is completely protein deficient. Okay, so you have group A, group B. Group A, you give 10 grams of protein for around 10 days. In group B, you give them other nutrients, but you do not give them any protein. Okay, so obviously the group A will have certain average weight gain. Okay, and in group B, since it was a protein deficient group, there will be weight loss. Average weight loss will be taken. Okay, so the average weight gain minus the average weight loss in this group divided by the protein which was consumed by the group A into 100. This will give the net protein ratio. These kind of experiments are done on rats and all. To humans, it is applying this kind of ratios to humans, they have certain limitations. Okay, so you can just read about these formulas, their limitations, how it cannot be applied, in which areas it can be applied. Okay, that is enough. Then we have scoring systems to determine based on the scoring systems, you will come into terms with the best quality of protein. What is given in the book, it was difficult to make it into an explanation. The image which I had shown you, that was easier for me to explain. To study what is given in the book. Just to clear your concept, I had put that particular image. Amino acid score. Okay, this is the formula which is used. The same is given in the textbook also. Okay, in this amino acid score, the different chemical composition of proteins in terms of their amino acids. Protein A will be different from protein B based on the extra or less amino acids it is given. Which the image in the slide is not visible. I can't can get what Manjari put the. Okay. So amino acid score, with the help of amino acid score, it is said that you can rank the proteins based on their amino acid score. Okay, so this score should be calculated for all the essential amino acids using the formula which is given, and the amino acids which has the lowest score is taken. The amino acid which has the lowest score is called the limiting amino acid. So these all things will come into the practical aspects in the medical field. Okay, related to more of the doctors who are practicing with nutrition and treating exclusively the patients who have this kind of malnutrition and all. For you, you can just read this topics just for understanding. Then we have protein digestibility corrected amino acid score, PDCAS, and the DIAS score, digestible indispensable amino acid score. So PDCAS is used by WHO as well as the FDA of the United States. So both of them, they use this to rate the protein quality. They rate the different types of food based on their protein quality. That this is the formula used. Okay, it is not given in the textbook, but just for your understanding, here this particular area in both the formula, that is mg of limiting amino acid divided by the mg of same amino acid 1 gram reference protein, this is what we call the amino acid score. You can put the amino acid score directly in these two areas. Okay, this is basically the formula for amino acid score. You have a reference protein, and usually reference proteins is egg. Egg is the most common reference protein which they use to test how better other sources of proteins are, or how negligible other sources of proteins are. So egg is usually the reference protein which you take in amino while to determine the protein content of other sources of food, other sources of protein in food. So when it comes to these scoring systems, just be clear about the abbreviations which is used. Okay, and the table is given that you can use in your practical aspect. Table 5.6 on page number 81. Use it in the practical aspect. No need to mug up the entire PD, CAS values, etc. How PDCAS is different from digestibility. In that, in DIAS score, you will understand if you have a certain gram of protein. Just imagine you are having 100 gram of protein. Okay, from this 100 gram of protein, how easy was it to digest a certain amount of protein? Okay, that is a digestibility. Digestible indispensable amino acid score. It will show you how easy it is to digest a limiting amino acid or digest any protein. Okay, so the protein which has the highest digestibility, naturally it comes under the best quality of protein. This is how DIAS score and everything helps in ranking different protein. These all scores are used to rank different sources of protein. Okay, Yeah, how it is used is PDCAs. It will be used to understand the recommended daily allowance when it comes to a certain source of protein. Okay, if you are having, if you are a vegetarian, okay, the sources of protein, the digestibility of that particular source of protein is different from a non-vegetarian diet. Okay, so you can't completely depend on recommended dietary allowance. The recommended dietary allowance will say this much gram of protein you should have based on your age, your gender, etc. Okay, but based on the on the source of protein, it may differ. Okay, a safe requirement should be there. So that is where PDCAs will be helpful. It will determine, it will rank the different sources of protein in such a way that a safe requirement from this particular source. If you are having chicken, have only this much gram of chicken through the entire day or for this particular meal, because this source of chicken has this quality of protein. It will help you in all the physiological function. So it will, both these scores will help you in ranking different sources of protein. uh, but the DIAS score is much more used because it will not only show how the protein is absorbed, but how easily a certain protein is digested. So that is the main difference between these two scores. Then we come to next page, that is 84, complementary value of protein. I have briefly touched upon this in the initial slides. Especially when it comes to incomplete protein sources, we have seen the classification of proteins: complete, incomplete, and partially complete. When it comes to partially complete sources, okay, they have few groups of amino acids, essential amino acids, which is not present in their protein molecular structure. Okay, if that missing amino acid is given by certain other different food, it is said that these two food is complementary to each other. Taking these two food at the same meal or during the same day will compensate each other's lack of amino acid, and it will give you optimum sources of protein. Okay, all the 9 essential amino acids will be delivered to you by using the combination of these two food items. Okay, that is complementary value of protein. Two or more incomplete protein sources, when eaten in combination at the same meal or during the same day, compensate for each other's missing amino acids. For example, grains are low in amino acids lysine, while beans and nuts, legumes, they are low in amino acid methionine. But grains have methionine, and legumes have lysine. So when you have both of these together, that you do not have a particular essential amino acid lacking diet. You have completed the all the 9 essential amino acids in your diet. So all the examples which is used in table 5.8, you can use that in your day-to-day cooking also. You can use that in consultation also, like idli dosa. When you are making idli or dosa, you know, it has legumes as well as grains. It has rice, urad dal, etc. Okay, so both this rice and urad dal, they are complementing each other in such way. There are certain amino acids which is not present in rice is there in urad dal, and which is not there in urad dal is there in rice. So you get the entire essential acids together. So that is the complementary value of protein. You can read through the examples like idli, dosa, khichdi, chapati. They are the excellent combination. They become the combination of cereals and legumes, grains and legumes. Then you have cereals and milk, payasam, paneer, cheese sandwich, curd rice, pasta, cheese, etc. And then you have coconut chutney, roasted Bengal gram dal. They have a combination of legumes and nuts and oils. So having these kind of food will make sure that you do not lack in certain essential amino acids. Your protein deficiency is out of way. Then requirements and RDA. No need to read much about the requirements. If for your personal knowledge, you can read that. But the important thing is in page number 5.11 on page 91. ICMR's recommended daily allowance for proteins. 2020, they have updated on 2020. Follow that for your consultation as well as for your knowledge. You can read that table. And different sources is given in page number 92, table 5.11, 5.12. These are the common sources of protein found in Indian diet. Okay, so 100 gram of particular type of food, how much gram of protein is available in that particular food is given in table 5.12 for consultation, and for your own personal purpose, that these two tables are more than enough. Requirements, you can just go through it, just read through it, understand it. There is not much in the requirement section for infants and although for children, all those head topics, it's not that important. Just read through it, because if you are clear with the recommended dietary allowances, that is more